Hello, this is Dr. Aditi. Today we're talking about the Flexor Retinaculum on Anatomy and Physiology Made Simple. Now, I want you to imagine your wrist like a busy highway tunnel where multiple tendons and nerves, i.e. vehicles, pass through this tunnel, right? And they pass through quite smoothly thanks to this ceiling that holds it all together, and that is referred to as the Flexor Retinaculum. We're going to use analogies and mnemonics and clear visuals to really help you understand the function of Flexor Retinaculum. And then at the end, we're going to talk about what happens if this tunnel collapses or narrows, or a traffic jam sort of happens, and what we call that carpal tunnel syndrome. So let's get cracking. The flexor retinaculum is like a seat belt for your wrist tendons. It's a strong fibrous band on the palmar side that actually holds all the flexor tendons down as they pass through the carpal tunnel. Now, without it, these tendons would likely pop out like spaghetti, right, when you bend your wrist. So think of the wrist as a curved bridge, right? So the base is the carpal bones, and then this flexor retinaculum covers across like a plank, and it creates this little tunnel because it sort of arches and it creates a tunnel. And this tunnel is called the carpal tunnel. Now I do have, let me show you where it's at first. So it's in this area, and then in order to know the attachment points, there are four that you need to be aware of. On the lateral side, which is going to be near your thumb, in the anatomical position, you've got the scaphoid and the trapezium. And on the medial side, you've got the pisiform and hamate carpal bones. So that's really where it attaches. Now, this mnemonic, some tunnels pass high, is a way you can definitely remember that. Right, so let's have a peek at what's actually in the carpal tunnel area. What are the contents like? So there's a bundle of nerves or cables, right, that go through here. So let me orient you. We've got the flexor retinaculum that's highlighted there. Then we've got this purplish area, which is your carpal tunnel. Then we've got a bunch of dots in there. Those spheres are your muscle tendons. And we're going to talk about which tendons go through there. Okay, so the first thing I want you to remember is the big orange yellowy spot that you see. That's your median nerve, right? That's going to be the main nerve of the ham. M for medium and M for the main nerve. And then there are four tendons you see that are more superficial. That's going to be your flexor digitorum superficialis tendons. So there's four on the top. And then, of course, you've got four on the bottom row. And that's going to be your flexor digitorum profundus tendons, okay? Then you've got this green dot on the other side of the median nerve, and that's actually your flexor pollicis longus. So those are the four main contents of the flexor retinaculum area, okay, the tunnel, carpal tunnel area. So how do you remember that? Well, I have a mnemonic. My sister's pretty lashes. So M is for median nerve, S is for superficialis, for flexor digitorum superficialis, P is for profundus, and L is for longus. And that's one way you can remember the contents of the flexor retinaculum. Okay, so what's in the roof of this tunnel, right? Or what's on the other side of the roof of this tunnel? So again, here is the flexor retinaculum, as you can see, but we're looking at what's superficial. So what's on the other side? The first thing you'll notice is palmaris longus tendon. That's sort of right in the middle and on top. Okay, and then you've got this yellow nerve, which you've probably guessed it, is the palmar cutaneous branch of the median nerve. Then we want to look on the ulnar side, and you see the ulnar nerve. So that's going to be closer to your pinky finger. And next to the ulnar nerve, we've got the ulnar artery. That makes sense, fairly easy, right? Then this purple spot is again a little outlier, and that's your flexor carpi radialis tendon. Okay, so, and again, that makes sense because it's near the radial side or your thumb side. And then we've got these green mounds. These are the thenar and hypothenar muscles. So that's essentially what is all superficial to the flexor retinaculum. Okay, lastly, let's look at the clinical significance here, something called carpal tunnel syndrome. This occurs when the median nerve that runs from the forearm into the palm of the hand becomes compressed or pinched, and this wrist carpal area, right? That's, you remember that carpal tunnel area where all the ligaments are going through. It's a very narrow passageway. So this flexor retinaculum, or another name for it is transverse carpal ligament, that's shown in the visual here, that sort of gets compressed and it pushes on the median nerve, which causes inflammation. So this tunnel essentially becomes inflamed, and it's often due to repetitive motion, swelling, or injury, and it puts this extreme pressure on the median nerve, which leads to symptoms like numbness, tingling, weakness, and even pain in that thumb, index, and middle fingers. A lot of people would describe it as, pins and needles sensation that sort of worsens at night or when they're doing tasks like typing or driving, right? Early detection and intervention are key. Treatment is basically with an OT who might create a wrist splint for you and ergonomic adjustments. There are also lots of anti-inflammatory strategies that you can try. And in some cases, extreme cases when nothing is helping, surgery can relieve the pressure, right? But obviously understanding this anatomy helps us explain both why and how behind the symptoms that patients experience with carpal tunnel syndrome. So there you have it. And here is our mind map of the flexor retinaculum, and you can see we've got the contents, the clinical significance, and the superficial structures highlighted here, and the mnemonics are also included on this mind map. So if this was helpful, helped cleared up some of the anatomy of the flexor retinaculum, please do give me a thumbs up and share it with your study group, and don't forget to comment if you'd like to download a free mind map on this topic, and I will be sure to get it to you. Until next time, bye.